Well, hello and welcome back, everyone. You have logged into Bright Spots in Healthcare. I am Eric Glazer. I am the CEO of Bright Spots Ventures, the producer of this wonderful program. We are dedicated to accelerating innovation through content, communities, and building meaningful connections. And our mission is simple: to spotlight what's working in healthcare and help scale it. We bring together healthcare leaders from health plans, hospitals, and other healthcare organizations across the land to share proven strategies that drive measurable impact. And through our podcast, our executive councils, our private events, and our go-to-market strategy work, we surface and amplify what we like to call bright spots in healthcare, proven innovations others can learn from and replicate to solve some of the biggest problems facing all of us in our industry. And at our core, we exist to foster trusted relationships that fuel progress because we believe the best way to improve healthcare is to find what works and clone it. If you've not subscribed to this wonderful show, this wonderful podcast, please stop what you're doing right now. Find your favorite podcast app and simply type in Bright Spots in Healthcare. And each week, you will have downloaded for you unbelievable ideas, insights from experts across the industry, like the esteemed panelists you see before you today. We're going to talk about right now new growth playbooks in an ever-changing healthcare market that we all live in and work in. Today's episode is going to explore how leading commercial executives are adopting their growth strategies to meet the changing landscape that we face. We'll break it down across three segments. At least we'll try to organize it in three ways. The first segment's going to be around reframing the sales narrative. Then we're going to talk about brand building. And then we're going to talk about creating scalable, content-driven account-based marketing initiatives. And so we are going to dive into it. Today, you have in front of you three awesome experts and guests, all who I consider friends. Our fourth guy, by the way, Ohad Pollock, is sick as a dog and his voice is terrible. So we decided to cut him from the show a couple of hours ago. We'll bring him back. He's the head of marketing at TitaCare. So we hope he feels better. But we have in front of you some unbelievable guests. And thank you in advance, all of you, for doing this at such short notice. So we have Andrew Duboak. He is the Chief Growth Officer at League. We have Ashley Perry, the founder and partner at Fitzroy International, and Ryan Schonecker, Chief Commercial Officer at Vori Health. I'm going to start with you, Andrew, with a two-part question. First, I want you to tell folks in like a minute or two, if they haven't heard of League, what they're all about, what you guys are all about. It's not a sports association, but something much cooler than that. And I want you to, in the context of that, talk about the buyer, the health, whether it's the health plan or the health system. But what's the biggest shift you've seen in how health plans, because I know you work a lot with those guys, how they are responding differently to sales and marketing efforts over the past, I don't know, we'll call it 18 to 24 months?
Eric, great question. Thanks for having us. Excited to be with you all today. As you mentioned, League is an enterprise software platform focused on the customer experience in healthcare. We work exclusively with some of the largest healthcare companies across the US, Canada, and globally. To your point, we work primarily with health insurers, so companies like Highmark Health, HCSC, Scan Health Plan, Santa Clara Family Health Plan, Manulife, Medibank as some examples across those geographies. But we also work with innovators in the healthcare ecosystem, including Metro Health System, Baptist Health Arkansas, Quest Diagnostics. So when you think about the work that we do at League, we are really partnering at the executive level of some of the largest companies in healthcare. We're part of very big programs to transform the digital customer experience. And those are multi-year programs that we're a part of. So when I think about the things that are evolving and changing that we're seeing with our customers, with our prospective customers in the healthcare ecosystem, particularly with payers, a few things come to mind. Number one, healthcare seems to really value this idea of franchise value. People don't necessarily want to be the first. They want to see that you've had impact, have delivered at scale, and are industrial strength for the complexity of operating in what's a pretty, heavyweight, complex industry. So very much we think a lot about how do we build long-term relationships with our customers? How do we build that franchise value? And how do we innovate over time with our customers to not just be there as a point solution to solve one small problem, but actually be a partner in innovation? The second thing that seems to be showing up in the work that we do at League is that I would describe it as the experience transformation is back. We've kind of gone through a few years where healthcare companies are really focused on battening down the hatches post-COVID. They're dealing with lots of complex operational cost and financial issues. And as we think about the next 5 years, what we're seeing a lot of healthcare executives shift back to is this mode of growth. And so for us at League, we're really thinking about how can we be a catalyst to that growth while also being a catalyst for productivity. The last thing that I would just say that does seem to be changing as a narrative that I'm sure we'll talk about quite a bit today is consistently now in the last even 3 to 4 months getting asked, what's your AI roadmap? How are you using AI in your products today? And where are you deploying that AI at scale with customers? And so the AI fluency, the AI native interest from buyers and customers when it comes to things like technology, software, customer experience has been a meaningful step change. And so that also pushes companies like League as product companies, as innovation companies, to really make sure that we're at the forefront of helping educate those companies on what's coming from a technology perspective, what's real versus what's smoke, and honestly giving really candid and honest perspectives about what can have impact or what's new. I'll pause there, Eric, to see if you want to keep poking at that or move forward.
Yeah, I do. I want to poke. First of all, for all of you listening, we will have some times for questions. It's the beauty of having 3 panelists versus 4. So you can use the Q&A module just to submit your questions, and our team will take a look at them and we'll try to integrate them into the conversation. So you said something, Andrew, that I think probably everyone in listening wants to figure out how to do, and that's not just be a point solution, but a partner in innovation. So do you think you guys are in a position to do that based upon the product you have, or have you made a purposeful go-to-market relationship building strategy shift to allow you to be open to doing things that may not be, I don't know, I don't want the product people to freak out if they're listening, but like not in the product roadmap that you customize so that you could become that growth and innovation partner versus just a point solution? Like, do you think you're in a unique position because of the product you're delivering, or do you think it's a purposeful commercial approach that you had to take to go in that direction?
To answer that question directly, this has been a very purposeful go-to-market commercial and product decision. It's one that we've been building towards over the last 4 to 5 years at League as we've evolved our business to this kind of platform transformation partner for customer experience. And for context for those listening, League is in our 11th year as a company. So we've had 10 years of building and launching and scaling digital health products in healthcare. It does feel like a little bit we're the 10-year overnight success just to even get to the start line of what's possible. And so, Eric, just to make it concrete, when we started down this road of what we called Powered by League, this building blocks platform idea, we made a few really intentional decisions. Number one, we were really looking for customers who wanted to be innovation partners with us. So I look at customers like Highmark Health and Shoppers Drug Mart, which is one of the largest pharmacy chains in North America. Those were some of our real anchor innovation partners to drive the product roadmap that League developed in partnership with them. So yes, we were working very closely with customers. They were influencing our roadmap. They were influencing our direction. And we were working hand in hand to develop a product for them that ultimately we believed would scale across the industry. The second big decision that we made was to be very focused on building deep partnerships with the other stakeholders that our customers work with in these bigger digital transformations. So for us, that became organizations like Google Cloud Platform, Accenture, Deloitte. And we really thought about how we could bring a better together set of solutions and offerings with those partners, and also help those partners deliver on a higher level of value on their platforms or with their services. And then the third thing that I would say, Eric, is we got really intentional about building the franchise value of being a thought leader on what we do at League. And so this point about you got to build franchises take time. We made a lot of intentional investments that we can talk more about in kind of building the League ecosystem, the brand, and the community of executives that we partner with.
Okay, so number one, under this sort of strategic partner powered by League strategy, you're looking for customers who want to be innovation partners. They help drive the product roadmap. Two, building deep partnerships with the other stakeholders that your customers work with. You gave examples of your clients who have Google Cloud, Deloitte, Accenture, and working with them as well. So you're building that. And then investing in the brand, the franchise value, you thought leadership and different programs. We'll get into some of the stuff that I know you do, including working with us. But around looking for customers who want to be innovation partners and letting them drive the roadmap, did you let them drive the roadmap once they signed pen to paper, or when they were, when you were still sort of working with them as a prospect with the hope that they become a long-term partner? When did you start that shift of looking for those individual organizations and then customizing things based upon what they were looking for?
At that stage of development of League, I would say that it was a combination of both. What were some of the core features or capabilities we might need to add to adapt our platform to a new use case to get to launch? But then ultimately putting in the governance and the partner structure to continue to work together over time on how we innovate and create. And that's led us to make another decision, which I'd say is a product decision, which is at League, we've invested in what we describe as our developer program. Think of that as a set of tools and capabilities that allow our customers to configure, customize, and extend League's product. And so we realized that we also can't solve for every use case. It's impossible. There's infinite surface area. We have to give our customers more tools and their partners more tools to try to fill in the pieces of the puzzle that maybe League hasn't got to yet. And so that narrative has also been a very powerful story. And now we've been starting to do work with our partners to actually integrate partner solutions more deeply in our platform to, again, have that kind of complete experience, not relying on all League R&D, but also benefiting from best-in-class partners in the ecosystem.
Like semi-open source, if you will.
Maybe I wouldn't go as far as saying open source, but I would say being thoughtful about giving customers tools to apply the technology to their use cases, which is not that different from, I think, this last generation of SaaS companies and SaaS platforms like Salesforce or others. It's really trying to take kind of some common building blocks and then giving customers the ability to apply that to the problems that they have. And for what it's worth, we could probably talk a lot about this as we get later in the show. But I think that enterprise sales motion that I'm describing right now is very much the traditional SaaS enterprise motion. There's lots of examples now where that's changing drastically in how people are adopting and buying new solutions when you think about some of the new AI products that are coming into the healthcare ecosystem.
I'm going to shift a little bit now to policy changes and our reaction to that. So I'm going to bring in Ashley Perry. She is the founder and partner at Fitzroy International. She is formerly in a leadership role on the commercial team at Socially Determined when she was a client. And so Ashley, first of all, I'd love for you to tell quickly everyone what Fitzroy International does, because it's probably relevant to most people listening. And then how are the recent policy changes, both within and outside of healthcare, shaping your overall commercial approach, and have these changes forced you to rethink your overall GTM strategy?
Yep. So first of all, thanks for having us on, Eric. Nice to be back on the show. So just for folks who aren't familiar with Fitzroy, we're an advisory services firm that works with institutional investors that are seeking to deploy capital into US-based healthcare assets. And when I say that, most people think VC or PE, but we're actually talking about a broader continuum of capital partners to include groups like infrastructure funds, pension plans, sovereign wealth funds, and lots of longer term, what I would describe as more patient as an adjective, not a noun, capital partners that are increasingly looking to healthcare in the US specifically as an investable asset class. So we work with them to understand what are the opportunities that we're seeing in the healthcare space. And then equally importantly, we spend most of our time working with nonprofit health systems, health plans, and other healthcare organizations to understand how can we bring those capital partners to the table to support their capital growth and diversified revenue needs. So that's what we do in a nutshell. As part of that, we have the benefit and pleasure of sitting at the nexus of a lot of conversations around health system, health plan growth strategy, how they're responding to external pressures in the market, including a lot that's happened recently on the policy and regulatory front. And so we're sitting in boardrooms, we're meeting with CEOs and CFOs and having those conversations, and then trying to open the aperture around potential solutions by thinking about alternative capital partners that could come in to help fund some of those strategies. So that in a nutshell is the work that we're doing. I would say the reaction recently to just the volume of policy changes that have been discussed, debated, passed, are still TBD, is that it's a pretty overwhelming moment for a lot of folks in our industry. I would say the most common theme in all of the conversations I've had with health plan executives, with health system CEOs and CFOs recently have been how much change they're dealing with and how much time they're spending about really macro influences that are changing the pressures on their organization, the pain points, and therefore going to have to change the strategies and solutions that they're deploying. That's a difficult thing for anyone to manage as a leader. It also creates an opportunity for those of us who are trying to partner with these organizations, because I think the sense of urgency and the commitment to creativity and innovation is the highest that I've seen in my career. And so people really are starting to roll up their sleeves and say, what are we going to do? Because the only thing we can't do is assume we can maintain the status quo. So we can talk more about what that looks like in particular markets or as it relates to particular lines of business if helpful. But I would say the good news for folks on this line should be there is urgency around acting, and that should be something that we all lean into.
You talk a little bit about how you see the need for the companies that you're working with for their GTM to shift to match the new problems of their ideal customer, maybe even provide an example, or maybe try them on however you want to go about doing it.
Yeah, so I think a couple of things. The first is that the pitch has to get much more pointed. And by that, I mean, when you walk in the door, I think you need to be able to articulate immediately, are you making them money or saving them money with what you're proposing? And you need to be clear about that yourself. And then you also need to be able to answer the question of how much and how fast, because there is real pressure right now on budgets. And so if you're asking any organization to add a net new line item to their budget, they're going to need to know with a high degree of confidence what they're going to get in return. So I think that that's really important as you think about refining your go-to-market strategy and your pitch, being really clear on the value prop and the ROI that you're offering and leading with that. The second thing I would say is because of the order of magnitude of change that these organizations are dealing with, to the extent that you can bake into your solution or your product tools to help them manage that, I think there's a real appetite for that in the market right now. And I'll give you just one quick example on that. There's a company called Vircho, VIRCHO. It's a social care management enablement platform, and specifically purpose-built to facilitate 1115 waivers and in lieu of service programs, which, as we all know, are complicated, state-specific, very administratively demanding programs that are difficult to manage. And so Vircho built an end-to-end platform to facilitate that, to meet all of the state or CMS's requirements. And so that includes things like training, credentialing, invoice payments, network management, capacity building, et cetera. But really importantly, they realize as part of that, that all of these waivers, all of the state regulations are constantly changing. And it's really hard for organizations, an MCO in California or a social care network in New York or North Carolina to stay up to date with all of the changes that the state is rolling out. And so if you can embed into a platform the ability to stay apace with those changes as they're announced, it really does allow your partners to not have to worry about managing the program and really focus on the core care delivery that they're trying to provide. So I would encourage solution providers to think about how can they manage those changes proactively, and is there a way that they can embed into their solutions things that incorporate those policy, regulatory, and payment changes that would help their customers be better prepared.
Okay, so I heard about 4 things I want to summarize here. For GTM, the pitch needs to be clear and concise. I think that was always the case, but maybe it's being heightened right now. And then you need to get to with how much you're going to save or make for them and how fast, right off the bat.
Yeah.
And for example, I guess it's 3. If you're able to show a customer how the impacts of policy changes that have on their business you could take care of on their behalf, you're ahead of the game versus everyone else.
Yeah, if you can relieve some of that burden of staying apace with all of the change that's happening, especially when you think about, super regional providers or MCOs that have footprints in multiple states, right? Where it's a very dynamic environment, it's changing all of the time, and they're trying to manage all of that in real time while running their business. If your solution can help them do that, I think you're in a much stronger position to help them succeed and then to have success in their commercial relationship. And I think recognizing the volume of change that a lot of organizations are dealing with, solution providers that can embed that adaptability into their offerings are going to be well positioned.
Great. Okay. We're going to finish out. I want to bring in Ryan Schonecker now, and then we're going to take some questions from the audience, some good questions in the queue, and then we'll go into the next segment. Meanwhile, at 45 minutes past the hour, folks, I'm going to be sending you another email with a link to a survey just to ask your feedback on today's show. In particular, this is going to be very useful for us. We look at all the survey respondents, but for this episode, as all of you know, we typically produce content with plans and health systems. This is a different episode, and so it's for solution providers. And so we'd love your feedback on how to make these episodes better. So 45 minutes after the hour, there'll be a survey that gets sent to you. We'll also put a link to the Survey Monkey right here in the chat, so you have easy access to it right now as well. So Ryan Schonecker is the Chief Commercial Officer at Vori Health, also a Bright Spots client. Ryan and I are former coworkers a lifetime ago, it seems like. Super excited to see him here. So Ryan, how do you approach commercializing solutions that actually have clinical implications, clinical impact, where both the clinician and maybe the product team are key stakeholders? How do you go about that?
Sure. I'll touch first on a little bit of what Ashley just mentioned, some of the changes with all the one big beautiful bill and other things that went through, right? The big changes. So we're a virtual first musculoskeletal medical practice that works mainly with health plans, employers, and then risk-bearing providers as well. So the first permanency of first dollar coverage on telehealth visits was a really big deal. We spent last year thinking about how do you rethink go-to-market. Last year, when it was not clear if they were going to extend that for high deductible health plans first dollar coverage, we had to change our whole approach of how are we going to talk about this? How are we going to actually bill our customers? Do we need to also bill members? How do we keep this free for as many people as possible? With this change, obviously, right away, that goes very quickly back to what Ashley mentioned of, going back to all of our clients, all of our prospects, and talking with them about what is this impact? How is this going to actually change what you're seeing within your program today? How is this going to change the outcomes that we can receive, that we can help you with? So for us, having, being a clinical solution, there are all kinds of things that change, whether it's clinical guidance and guidelines for care for individuals, to policy changes, to just market entrance and different changes that way too. But the largest change in the markets that I've seen, I know, for people, most people on this call are health plan and providers, but I'd say the employer market has changed the largest, without a doubt. Policy related, obviously, Medicaid's going through a lot right now, but setting that aside, I think, some things remain true. So when you're rethinking your go-to-market, you always have to stay anchored back to the things that are critically important, which is what's the value we're delivering here for the end buyer, whether that's savings-based or some cases revenue-based. But thinking through, what are the things that are always going to remain true? So it's just going back to what's your moat within your business, and then leaning further into that in times of turmoil. So for us being a clinical solution and the most clinical within our space, it's all right, what can physicians do that other people that are not physicians can't do? How can we show that? What are some pre-sale analytics tools we can put together that, gets buy-in from our customers, that they have to have some kind of a light lift within on their own within the buying process to get us over some high-level data to help us model and show them the value we're going to have, not with abstract like, hey, in the Northeast, here's what this is, or nationally, we think we can save you this much. It's using their own numbers to bring it back. So you're really building the business case for them that they're advancing and bringing to their CFO at the end of the day. And so how can you make that as easy as possible for them? And how can your tools give them new and different insights that are unique that they may not be hearing from somebody else? So yes, sprinkle in your data, but also you have to use their data to find something unique and interesting. And that becomes the number one thing that's going to get them to say, okay, this is interesting. This company I'm talking to is more than just a vendor. I can see, like to what Andrew talked about, I can see them as a partner that I can rely on in times of change, as Ashley mentioned, as well as in times of need where I just need to actually have something work and make this be something that I want to promote and stand behind.
Yeah, and this was one of the cooler examples I heard when we were prepping, Ryan. I would love for you to, and it resonates. When you say this pre-sales tool, could you get a little bit more descriptive and illustrative on what it is, and maybe talk to like what's the balance of how you create something that's going to actually demonstrate the value that that Vori could provide more long term, but without breaking the bank around time and energy that both you have to put in and a prospect has to put in. Like there has to be almost a product strategy in creating that pre-sales tool.
Yeah, absolutely. So you always, and a lot of people have seen on different people's websites, like here's a slider, put how many members you have, put, your average spend per year, and it spits out something pretty generic to you. This is going deeper than that because I think that's nice to have on a website. And trust me, I think any company I've worked for, we've had something like that and built towards that, just to have some way to demonstrate value. But it's going a little further than that. And so instead of saying, give me your last 3 years of medical claims and pharmacy claims, which is going to be a huge lift, and they're going to be like, I have to contract with you to be able to give you that. I can't do that. Ask them for something lighter. Say, okay, can I get summary claims? Don't give me anything that has, any PHI in there. Can you give me summary level claims so I can get a feel for, quantity of these procedures or quantities of these conditions or people who are running into this? Of your total. And then that helps me understand, okay, what percentage of your population has this condition or would be impacted by this solution I'm proposing. And it could be, that's more clinical based, but you could be how many, if you're using a system or a platform, how many people are using the one that you have today? All right, what's our realistic conversion rates based on that? And then you come back and you say, all right, here's what we really project. And then bare minimum, what's the baseline that there's no way we're going to do worse than this. So that's where my performance guarantees are going to be. And if you want the performance guarantees to be better than that, let's now have a conversation to talk through what needs to be true in this relationship for us to guarantee you more than that. And so now you're in a conversation that's engaging with them around, all right, I can't do these 3 things you asked about, but I can do these 4. Cool. What does that get me? And then it's incrementally saying, here's what we know. It also shows them that you know your business and you understand what works and what doesn't work and what levers to pull to try to gain better results for what you're doing. So those are some of the things that we do, and I hope they give you enough specifics.
Yeah, that's great. I'm going to bring in, and I'll start with you, Andrew, and then Ashley and Ryan can jump in because some really good questions here. So, and then we'll transition over to sort of brand and storytelling. So, Andrew and all of you, like, what are you seeing in the market as far as integration needs or capabilities with other point solutions? I.e., when a client wants to diversify vendors versus sole source vendor. And then second to such, how are you establishing solid ROI methodologies to demonstrate that value and avoiding like double counting value and savings?
Mm-hmm.
Happy to jump in. When it comes to integration, this is something we think a lot about at League, given that we are in many ways a form of infrastructure software. A couple things come to mind for me, Eric. Number one, there is a theme of having less partners and vendors, not more. So we have kind of lived through the last 5-10 years of this kind of digital health proliferation. And customers are thinking a lot more about how do I actually pick my partners, that less is more. And actually, I can probably get better outcomes if I can better connect those partners in a more seamless way. I would say that defining the integration standards and making them truly standards is still pretty early days. I'm not seeing a one consistent way of connecting lots of disparate, let's say, digital health vendors or other technology solutions. But the aspiration is there to kind of have partners that can help connect, that are built on modern technology, and that also have more of a open architecture philosophy of let's actually try to help the patient, let's help the member. And to do that, we need to share data, we need to share insight, and we need to make this fundamentally easier to navigate for a patient or a member. And when it comes to ROI, I don't know that the game has changed on ROI in terms of how to think about doing the math. But for a partner like League, let's say, we might get benefit from driving adoption of an MSK solution like Ryan's company is working on and delivering, or we might get benefit from driving adoption and enrollment in a virtual medicine practice or having a visit, but we're not going to get the full benefit. We might get attributed some of it. Obviously, the ROI is going to go to those other partners. So it's really about trying to be crisp about what part of the workflow or the journey are you influencing and being crisp on why that matters.
Ashley, anything to add to that? And Ryan, I have a separate follow-up for you.
So I would just say on the integration piece, it's really important for companies to think about where they sit on the value creation chain and what other data sources, what other vendor partners are key components of that. I think too often we only think about our piece of what is typically a very large and complex puzzle. And if we skip the integration step, I think we're only doubling down on the data silos challenge that we've had in this industry forever. So I think that's really important. I would just share one example. So the company that I mentioned earlier, Virtuo, who's the social care network management platform, they recognized in the early days that the referral part of those 1115 waiver programs or the in lieu of service programs is an essential piece. And so they've done integrations with all of the social care referral platforms. So Find Help, Unite Us, there are some homegrown ones in specific states. And so they've been really intentional about saying, we have a lot of data sitting in our enterprise system, but we need to make sure that that's connected to the other components that really make the solution work as a whole. And so I think it's incumbent on all of us to think about those data partners and other data sources and make sure that we're building not just what's going to work for the data we need for our solution, but for everyone in that value chain.
Okay, so I'm going to summarize what I heard there from both Andrew and Ashley. First of all, there's a theme of less partners, not more, although I would argue that varies by market to market, but we're not going to get into that debate right now. But I think connecting partners in a seamless way is important, but there's no standard or consistent way to do it. Could be an opportunity, companies like League and others. And then deriving a model that gets you the right appropriate credit. And that leads into what Ashley said, where companies must be honest. These are my words. Tell me if I'm misstating what you meant there. Companies must be honest to where they fit in the value creation chain for that organization, for that client, that shared client. And I've seen companies that have way over indexed on the value and where they sat in the chain. And because of that, ended up in time becoming obsolete on that chain. So I think it's really important to know who you are and the value so that you could not over index on where you sit.
Eric, maybe just to add a thought, which was tied to another question, and I'm sure Ryan has lots of thoughts about, which is this idea of risk-based pricing. So I'm sure there's a very different answer for companies like Ryan's who are delivering care. But when I think about kind of core technology vendors, I don't see a movement towards risk-based pricing. And some of that goes back to the really hard bit here in this value chain that Ashley was describing is many companies aren't confident yet in anchoring on this is the value that this solution will drive, and I'm going to put finances at risk. It's still early stage in its evolution. I would say most companies seem to prefer more traditional kind of SaaS models for how they buy and procure and partner on technology. But we are seeing some of the leading companies push on, I want to try to drive vendors, including like League, to align more on value, which we would love to do. But it comes back to the confidence and the fidelity of the forecasting and kind of building of that value case.
Makes sense. Ryan, I want to follow up with you because it's a question also from someone listening and watching. To the point about using clients' data as part of the pitch, how have you handled scenarios where you can't access the appropriate data? And as far as the barriers that could be blocking you, whether it be the consultant, the broker, wherever, to collate all that important stuff, like how have you handled all that, and how do you get across all that?
Yeah, I mean, the amount of work the other person's going to put in the dance that you're doing as you're bringing on a new customer shows you also a level of commitment, right? So if they say I cannot get this without having a document in place, then okay, how can I show you enough value now that's going to get you to go get a BAA written for, between us? I know it's going to add time, and that's okay, but that's part of your process anyway. You look at the things and the milestones that you're trying to do as you're working towards a relationship with someone. You're going to have to do that anyway. So if that's part of the business case building and you can do that now, fantastic. Let's get that out of the way. And it may delay things a month for you building that business case. So you get to ask yourself, is there a specific time of year, like, hey, they need to file a Medicare Advantage benefit and you need to be in that. So you can't wait the extra month to do that because they have all their leadership meetings before that. Okay, great. If that's the case, then show them, here's a proxy for what we've got for you. Here's the best connections that we've got. What are other business cases you've given and that have successfully been approved before by this group that you're going to present to? Take those and figure out how can I match back. But again, it's them showing you something of their own. It's them bringing something to the table. Because if they say, oh, sorry, I can't get that data. Okay, well, what can you get? Like, I'll bring you all kinds of stuff, but what do you need? And so the more thought they put into it, the more they're really invested. So a lot of times if someone just says, I can't get that for you, they're not that interested. And so then you have to figure out, okay, is this the right person? Or am I not making this clear what the business case is that we're trying to solve for them? But, going way back, there's always two parts to every deal, right? There's the, professional win. So how are you helping their business advance? And then there's the personal professional. How are you helping them get a win personally and professionally with this that's either going to advance their career or help solidify where they are in their career too. So understanding those, understanding like, are you part of that plan too? If you're not, they're not going to help that much. And it's going to be really hard to advance and get that data.
That's so important. When I spend a lot of time, as people who know me, running solution strategy at Teladoc Health, and when we were in those finalist opportunities, we had to take into account the personal gain and risk at stake for the individuals who are going to make the decision or recommendation. And I think far too often we forget about that when we're going through that process. So it's music to my ears.
Well, and that's the consolidation part too. That was a question earlier, like why do they want to consolidate? If you have an existing contract, you can just add another point solution on your existing contract. You don't have to go through procurement. You don't have to spend months doing that. And they don't have to make the business case and put their credibility on the line saying, this is why I need this new vendor. It's like, oh yeah, my existing vendor, here's an add-on. They don't actually have to take any of those risks. So that's a lot of times why people will do that. Even if it's an inferior solution, they don't care because they're not staking anything by doing that, versus if you can show them, here is why this is so differentiated and worth you putting the time, energy, and reputation out there. It's a harder sale that way, but that's where you have to figure out, is it really worth it to them?
It's a really good segue to for where I want to go next. So I want to speak to everyone listening who are all out there trying to do what Ryan's alluding to, and that's deepen relationships with either health plans or health systems, or either if you're selling maybe into health tech. And just to talk a little bit about what Bright Spots Ventures does, because we're often mistaken for just bright spots in healthcare. But like I said at the beginning, we believe the best way to transform the industry is by finding what's already working and scaling it. Like an episode like you're hearing today, things that are working for Ryan, Andrew, and Ashley. How could you scale those? That's the core of sort of the science of positive deviance. It's finding bright spots that actually drive change, that improving the drive change within today's constraints. So the companies that you're hearing about today are those bright spots in commercial. And so they partnered with Bright Spots and our organization, not just to raise their visibility, but to turn thought leadership into commercial momentum. And what we do this by producing content that resonates, like this episode, but we also turn it into short form video reels, that your commercial teams can use immediately. We design executive dinners and private events and leadership councils and advisory councils that bring your buyers into meaningful conversations for you, not just marketing funnels. And we help turn that engagement into actual meetings and ultimately deals. And what also makes us different, and I alluded to this, is just our experience. I've spent over a decade helping lead solution strategy for Teladoc Health. So I know what it takes and the pains and trials and tribulations to sell into health plans and providers. Our head of production, Haritha, brings years of experience building C-suite convenings across healthcare, including being part of World Healthcare Congress. Our head of marketing, Lisa, has led GTM strategy at multiple health tech startups. And our latest addition to the leadership team, Desiree, comes from Highmark's value-based strategy team, and she helps build our executive councils for us and is building now connections for us that are actually going to help move the market. So we've been doing this for a long time. The show's been going on since 2014, and we know your buyers and we know how to help you grow. So if you're looking for a partner in these kind of changing times and intense times, it's more than just a media company. I'd love to talk to you more about how we can collaborate and help you guys. And if you want to set up a meeting with me or my team, we'll put up a quick poll there. And we're going to move now on to, while we do that poll, to brand and storytelling. I'm bringing Andrew here. Andrew, in a crowded, but a quick disclaimer, I got to hear Andrew interview live Michael Lewis, who's an awesome storyteller, one of the leading thought leaders and authors in our world around storytelling, and you did an awesome job with that. And I want to talk about how brand differentiation, how you talked about franchise equity, is about trust, and trust is built often through story. And whether you're introducing a new category or trying to stay top of mind, the way that you're talking about franchise value, the story shapes how your brand is perceived. And so how do you craft those stories so your client and not the solution is always the hero? And what does it look like in your pitches and your sales presentations and your content and your marketing content?
First off, Eric, my thinking on this has changed a lot, even in the last 24 months, in the role of narrative in building brand and building trust as part of, essentially building an enterprise software company. If we went back 2 years ago, 3 years ago, I would say even at League, we tended to tell a story that was healthcare is broken. And what I realized about the healthcare is broken story is that, one, it's not different. Two, everybody's been saying it. And three, it probably hasn't changed for at least a decade, if not more. Maybe it's a 20-year-old story. And so I started to realize that the healthcare is broken narrative also didn't affect change. It wasn't what inspired people to do amazing things, or in Ryan's example, in a big company, for someone to drive forward and push against some of the inertia to do nothing, to actually, make something new happen. And what Michael Lewis said when we were together earlier this year, Eric, that stood out to me was that Michael Lewis always told stories, whether it's in Moneyball, The Big Short, etc., of these kind of unsung heroes, these people doing amazing things that you've never heard of. And they weren't even looking for notoriety. And what that kind of struck in me was this insight that I was also starting to build was, instead of telling the healthcare is broken story, and using that to drive urgency and change, what if we told the story of what our customers are doing to lead the way? And it doesn't even have to be how they've solved the problem. It's just the fact that they framed a problem, they saw an opportunity, and they started to take action. So I think a lot about, we've changed at League how we've been marketing this year from a demand generation perspective. We've been very intentional about every month trying to have a customer just tell us a story, no matter where they are in their journey. And for me, the one that stands out the most this year has been a woman by the name, an executive leader by the name of Julie Nix, who's a corporate vice president with Baptist Health Arkansas, who saw that there was a maternal health crisis, maternal mortality and infant mortality crisis in the state of Arkansas, that's really tied to this challenge of many expectant mothers don't have access to healthcare. There's care deserts across the state. Many people are struggling kind of to get care access on state Medicaid programs. And she felt like digital and virtual care was a way to reach these expectant mothers and meaningfully change maternal and infant mortality in the state. Have we achieved the goal in partnering with her? She's partnering with League as part of that solution. No, we haven't achieved the goal yet, but we're on the journey. And so let's help celebrate the work and the ambition that Julie has and let her tell that story. And then hopefully that inspires others to do the same.
That's awesome. That's awesome. And then you said, is that Baptist you said?
Baptist Health Arkansas. Yeah.
And
And to me, what I think about as well is how can you prove doing something new in one part of the healthcare ecosystem and then scale it massively? So if you think of the opportunity for someone like Julie, it might be starting with maternal health care, but then how do we think about broader population health and condition management? How do we think about oncology? There's so many other places where these issues are pervasive in terms of lack of care access, et cetera, but change is hard. And so Julie's doing this amazing work of kind of leading the way, and it needs to be celebrated.
Well, and that I'm sure embraces, endears you guys to the market as well. Ryan, what are some ways that you at Vori are building trust before a buyer even takes a meeting? When you're still sort of trying to earn that right to that first conversation.
Yeah, I mean, there's the awareness components, right? But then the trust building also starts with if you're a big organization, you have lots of clients, you can gain trust by showcasing those clients and kind of what they're doing and the success that they're finding with you, right? These kind of built-in testimonials from customers. If you're an organization that's still growing, there's a few things you can do. You can obviously leverage contacts, relationships that exist. You can find ways to serve on different committees, kind of sitting shoulder to shoulder with organizations that you want to partner with, so they're seeing you as a peer that way. I think if you have deep expertise in any area within your organization, flex it. Make sure you're creating content around it. You're getting information out there. You can do it through performance guarantees to stand behind your work to try to gain credibility that way. Or you can find ways to, affiliate yourself with these different brands in different ways. Like one of the things we do is bright spots, obviously, right? So being able to do presentations alongside the nation's largest health plans is really helpful, because not only do we get to hear their story and understand what challenges they're facing, but publicly people are seeing us affiliated with those brands, which is really helpful for us.
What about a couple of other things that I just want to know? One of the things I thought you guys do kind of, which is very grassroots and extra effort, is focusing on regional gatherings and committees and getting your teams out there just to meet folks.
Yeah.
Can you talk a little bit about that?
Sure. I mean, that's part of the initiatives that we do with the different, sales team members, is that they look for in their defined territory or market base, they look for different types of organizations that your contacts, your future customers, existing customers are a part of. Join those organizations, join committees with them, and can work shoulder to shoulder with those people. I mean, I think it's really helpful to be seen in the communities that you want to be helping and partnering with. So the team works hard at getting that stuff in place, and that's something that we're focused on, to make sure that they know that, hey, we're there. We may not have $150 million marketing budget like other people in our space may have. However, here are the ways that we're making an impact.
Yeah, that's super smart. One of the things of over a decade of experience of going into health plans offices taught me is they don't really give a crap about your solution, your features and benefits. And it was talked about earlier, they really only care about themselves and solving a problem they have. And I think back, there's an example. As part of my role, I produced a lot of our big finalist presentations when I was at Teladoc, and we had a big press release at one point bragging about 50 million virtual care visits. And I remember talking to the CEO at the time and saying, no one really gives a shit about our 50 million visits. So it's just talking about us and bragging about us. But what if we framed it, when you started off this 3-hour presentation, that what 50 million visits over 20 years means is that we've screwed up the most. And we've fixed all those screw ups and made enhancements. And over 20 years, what that means for all of you is having the most reliable, tried, true, tested platform available. And what that did for us, and it was immediately accepted as a story that my CEO wanted to tell. He loved it. Is one, it showed why the 50 million visits actually mattered to the audience, and two, it showed some vulnerability and built some trust up with the people in the audience. And what I would say to everyone listening, when you're thinking about crafting your go-to-market or your presentation or everything else you're trying to do, whether you're going to regional meetings, is make sure that you realize that they're in it for themselves and they're not in it for your stuff, and to craft how you talk about it in that way. And so, Ashley, I want to bring you in. I know in some ways we align on some of this, but you just heard Ryan talking about trust. You heard me pontificating of that. Ryan does a lot of different things with his team to build trust before even getting a meeting. From your perspective, how do you see what's working most effectively once you get the meeting to strengthen that relationship and establish ongoing trust with the client?
Yeah, I think there are a couple of strategies that seem to differentiate what that more mature phase of the sales cycle looks like. The first is, I think, really over-investing time. To Ryan's point about building relationships and trust, you see a lot of companies, as soon as they get someone in the pipeline, they just kind of put it on this automated machine, right? And so they're going to do the demo, and then they're going to do this and that. And I think instead leading with over-investing time, and not just time from the sales team, but time from the broader team, especially if you're an earlier stage company where you're still proving who you are, getting the leadership team engaged, getting the technical team engaged earlier, and really demonstrating that you have commitment to not just the solution that you're building, but what that solution is going to do for that potential customer. I think that goes a long way. Second, and related, I think, is to listen first and solution second. And too many companies walk in and say, I know what your problem is. I'm going to tell you how to run your business, buy my widget, and everything will be great. And instead, I think if they ask questions first and are curious and listen to what are the actual problems that this individual and organization are struggling with, number one, you can pitch your solution much more appropriately because you can tune it based on what you hear. And number two, you build that trust faster because they know that you actually care about them, not just closing a deal. And so I think that takes organizations pretty far. And then I think the third piece is making sure, as you're structuring the commercial terms of the agreement, that you have aligned incentives. And ultimately, that if you're going to win, they're going to win, and that you're going to do that together. Because too often, if you don't have that alignment, then even if you're successful in closing the contract, it's not going to be a successful relationship over the long term. And I've seen a lot of organizations do really well by focusing on those three things. And they might have the same top of funnel pipeline, but they have much higher conversion rates as you get deeper into the funnel if they can focus on that, investing time, listening first, solutioning second, and aligning incentives.
Great. I have two areas I want to close out with. We'll see if we can do it in 6 minutes here. Ryan, I want you to talk about collaborating across teams, especially marketing, and how you take a more, and how to make sure you're taking a more account-based approach. Then I'm going to quickly shift over to Andrew to close this off about taking, having big enterprises kind of do new things, because that's what we're trying to do, all of us. So I'll start with you, Ryan, and we'll shift right over to Andrew and try to end right on time.
Sure. So we do ABM campaigns, as you can imagine, right? So the team has gone through and looked at organizations that they want to make sure we're partnering with, and we run traditional ABM campaigns, then we do some non-traditional stuff too. So obviously having a mixture of video content, long form, short form, different ways to get in front of people. But also what we'll do is sometimes I don't know if there's health plans on here, but we'll do things that look like corporate communications, but they're really just targeted to a group of 8 or 10 people. So we'll do things like if we have a specific client or prospect that we're talking to, and they have a little bit different needs than what we're going to do in like our monthly newsletter or something like that goes to everybody, we'll push another quote unquote monthly newsletter out that is only focused on that one customer. And it goes to a total of 8 people when they think it's going to 80,000. And that's been very effective for making sure that they see that, oh no, that's not the salesperson doing that. It came from marketing. That's a marketing outreach. It's been an effective way to try to get the message that you're looking for across. when at times in the sales process, there's quiet periods by design, unless they'll say, reach out to me in a couple of weeks. Well, sometimes that can land because it's coming from marketing.
And getting enterprises to do new things, especially big enterprises, Andrew?
Yeah, Eric, you and I in the prep talked a little bit about this statement I make with my team, which is focus on the transformation, not the transaction. And so when you start with the transformation mindset, that helps, I think, large organizations see what's possible, see that there's ways to create new value, and think differently. It also helps you get out of features and functions because it's about something bigger than just solving a minute problem. And there's two things that are top of mind for me when I think about how to, practically think about this transformation versus transaction way of partnering with customers and this way of selling. One of them that I'm personally using right now is starting to talk about what did we hear 5 years ago when we were working with customers like you versus what do we think the next 5 years looks like? It helps reframe and reshift the mindset to not having the same conversations we've been having for the last 5 years, but thinking about how the context is different and helping people think a little bit more beyond the next quarter or the next 12 months. In the world that we play in League, when you think about customer experience, one big thing is AI is likely to completely change the way that we interact with technology and the way that we interact with any service that we consume, including in healthcare. That's a massive change that our customers need to be thinking about, not just how do I build a better mobile app. So that's just one example of how to do that. The second is, and Eric, you and I talked about this, we're a really exciting RFP with a very large or for a very large global healthcare organization. How we're responding to that RFP is actually with things that aren't even in the RFP. And we're doing it with Accenture. So we're actually with Accenture painting a much bigger vision in the response to the RFP. So that's an example of the customer has a problem. They have a kind of a defined set of requirements on how they think they want to solve that problem. And we're showing up with, actually, you need to solve this problem completely differently and reframe the problem itself. And I think that's a great example of how to lean in with partners and tell bigger stories and take some risk that just because the requirements are a set of 10 things, it doesn't mean you have to respond exactly with a bunch of check marks. It's hard to stand out when you're just getting spreadsheeted against every vendor going through the same process.
Totally agree. If you could showcase your expertise and show them that there's something that you may know that they don't, boy, that puts you a leg up. I imagine you have to use story too. I mean, talk about transformation. I love selling transformation, not the transaction. Doing it through story. I just read about sort of Bob Iger's decision to when he acquired Fox and what a huge gamble that was. But why he did it was that his industry was transforming to streaming and they needed the content and the capabilities. And it was a massive bet, but he knew. And I think about a story like that and telling it to someone in healthcare, because we're like 10 years behind them, behind entertainment in that regard, could certainly inspire someone to transform versus just transact. I don't know how much do you employ that in your sales tactics?
I would say you have to use narrative, which is another word to describe telling a story, and you have to show and tell. So you have to make it real. Right, like you have to go from the conceptual to the something that you can touch, feel, see, be tactile. Which I know at times in the sales process, we all will get concerned about. Like, don't rush to demo too soon. You actually have to do deeper discovery, listen to your customer longer. But there's something before demo that's actually this kind of what I describe as show and tell. How do you use story, narrative, visuals to bring products to life before you go into a real deep technical deep dive into what your solution might be?
Amen. Ashley, Ryan, Andrew, thank you all three for doing this for me. Appreciate you. Not just for the show, but everything that we do together. Thank you all who are listening and watching for tuning in. We do not take the time you spend with us for granted. We know you're super busy. We appreciate you making time for us on your calendar. We hope you use the ideas, the bright spots shared today to inspire your thinking and enhance your organization's current approach to improving healthcare for all of us. We produce this show for you. And remember, this is your Bright Spots in Healthcare podcast. Take care.